Hi, my name is Emily Ferguson, and I'm the Associate Managing Editor of the Post-Acute Care content at MCG Health, which includes home care, recovery facility care, transitions of care, and chronic care guidelines. MCG Health also provides evidence-based guidance at all levels of the healthcare continuum. And the presentation you're viewing today is a recording of what we presented at the NCQA Health Summit and Innovation Summit in October of 2023. So today we're going to talk about two of our solutions at MCG Health, chronic care management and transitions of care, and how they can assist in overcoming the challenges of patient-centered care planning, closing gaps in healthcare equity, and meeting some of the goals discussed by NCQA. I think we all go into care planning with a goal in mind. It's just along the way, we're faced with challenges that can take us off of our course. Time is certainly one of them. Comprehensive assessments can be very long, and those meaningful conversations that we would like to have with our patients are often curtailed by tight schedules, and this can in turn compromise quality. Depending on your population of focus, weaving in the insights of subject matter experts to ensure that all aspects of content are being covered can be logistically challenging. Patient engagement is also sometimes a challenge. I have had the privilege of working in disease management for over 20 years, and my patients and members never seem to want to talk about what I need to educate them on that particular day. I get a lot of good information about their healthcare, but sometimes staying focused can be a challenge. Planning goals can also be challenging as well. Determining what's meaningful and achievable for a patient might not always match your organizational goals. This is true especially in the context of social determinants of health. Finding transportation to get to a grocery store may be more important than planning out the details of a heart-healthy diet with a patient. Education that meets the patient's health literacy is another obstacle, as well as measuring what their literacy levels are. And this can be challenging, especially if the information lives in another assessment outside of your care planning tool. Having all that information in one place can be very helpful. Planning care coordination for complex conditions might be a concern. What's the next step? Who do we involve in the plan of care? And where do we refer this patient to? When planning for populations and disease management, evidence is also critically important to forming a clinically impactful plan of care. It's essential to look at evidence and consider where it's coming from. Is it only coming from one textbook, website, or one specialty society, or are you considering several sources as you collate evidence? And of course, meaningful measurement is the key in determining if we are successful in that care planning journey. MCG chronic care and transitions of care guidelines can assist in all of these care planning challenges, while also providing the added focus of a health equity and health-related social needs lens. The goal of our transitions of care product is to reduce readmissions and improve those outcomes following a hospital discharge, and it's designed for short-term case management immediately following hospitalizations. We cover over 33 conditions, as well as offer benchmark data for lengths of stay. Our chronic care guidelines improve patient self-management and outcomes for chronic conditions, long-term condition management, essentially. We include evidence-based standard assessments, care plans, and patient handouts that support in-person, telephonic, or low intensity, like a mail-only program. And we include over 44 chronic conditions in our chronic care management guidelines. These include pediatrics, obstetrics, several behavioral health diagnoses, cancer, and so many others. There are also points of service modules for clinical symptoms and interventions during engagement activities that focus on several quality measures. These guidelines are all designed to form a plan of care based on patients' assessment and their responses. The goals that are included in our care plans, and they're recommended with the concepts of being specific, measurable, achievable, reasonable, and time specific, those SMART goal formats. As coding and interventions also become more unified, MCG considers intervention components that match quality standards for payment and reimbursement models. This is especially important with social determinants of health standards and terminology for domains such as food insecurity, housing instability, homelessness, and transportation. Our social determinants of health content includes over 12 assessments and plans of care that can be used to manage referrals and also provide appropriate interventions specific to the areas that your organization is focusing on. Our social determinants of health assessments align with many of the gold standard assessments that are currently being used, such as PREPARE or the Accountable Health Community Screening. We are also frequently reviewing any updates that would impact social determinants of health, such as through the Centers for Medicare and Medicaid Services, CMS. Our social determinants of health assessments also look at components of NCQA's Health Equity and Health Equity Plus standards to consider how to best meet organizations' needs. Both transitions of care and chronic care guidelines provide educational materials written at the 4th to 6th grade reading level. And this is so important. They can be given to the patient, and the readability level is gauged using several tools, such as the Dale Chall, Lush Kincaid, SMOG, and several others. These handouts are available in PDF forms for easy printing, and they're also available in Spanish as we consider health equity needs. Handouts include several diaries, such as a weight diary, and these can assist patients in tracking the progress against their goals. The evidence for these are supported and found cited within corresponding interventions in our plans of care. In 2021, a survey was conducted by an independent third party, and 77% of our payer clients responded found that MCG's social determinants of health assessments were beneficial in several key areas. These assessments, which are integrated into several of MCG contents, such as inpatient and surgical care, behavioral health, as well as transitions of care and chronic care guidelines, have proven instrumental in improving overall member health, addressing unmet needs, enhancing population health management, and notably reducing hospital admissions. One of the most exciting things about MCG products are how they are supported by evidence. This is so important, and every year our clinical editors review thousands of journal citations and peer-reviewed medical literature, national guidelines and textbooks, professional standards and quality measures, NCQA accreditation volumes, and national claims databases. Because of our commitment to evidence, NCQA's population health standards list MCG chronic care guidelines as one example of evidence-based guidelines that can be useful for developing a population health program. Our evidence summaries present a review of the evidence that supports the statements made in guidelines, such as a particular care plan activity or intervention. Along with the review of the evidence, MCG also has a rigorous peer review process. Each one of our guidelines are updated annually and sent to subject matter experts like physicians, nurses, occupational physical therapy, speech language pathologists to provide feedback, and we take their recommendations and incorporate them into our content annually. Nothing really demonstrates our help to the healthcare community more so than our clients' own stories. Sharp Reese Steely launched a program to boost cardiovascular health for Medicare patients focused on holistic care. They enrolled over 1,300 patients with health risks like high blood pressure, and they used MCG guidance to develop comprehensive care plans. These care plans covered everything from diet to exercise, medication management, And their goal was to tackle the alarming number of patients with uncontrolled hypertension. With the help of their diverse care team and MCG's chronic care guidelines, they created a unified evidence-based approach. Their results were impressive: improved medication adherence, significant drops in heart attack and strokes, and $7 million in saved healthcare costs. Another customer's evidence of success: in September of 2022, St. Luke's received the highest level of case management accreditation from NCQA, lasting 3 years for their case management products. They used evidence-based MCG chronic care guidelines in their electronic health records to assess and plan care for patients, emphasizing patient-centered care and evidence-based care. And there are many other stories. This is from Innovation Care Partners, and they have utilized MCG guidance as a tool for their NCQA accreditation. Sharp Reese Steely also discussed evidence-based practice and how MCG meets this beautifully. For Quartz Health, they've also utilized MCG to assist in meeting their NCQA accreditation, and they feel more confident. They also went on to say that they have integrated with Epic, and everything has come together, and there is it's all in the same format and has been very useful for their program. Thank you all for attending today, and if you are interested in learning more, please reach out to mcg.com. Thank you.